Today we'll be taking blood pressure. You will need a stethoscope and a sphygmomanometer with a reading that says millimeters of mercury. First, you want to ensure that your stethoscope earpieces are pointed out before putting them on. And make sure that your stethoscope is on. Now you want to ensure that your patient is properly seated with their arms elevated on a table, feet flat on the ground, and relaxed on a chair for at least 5 minutes prior to testing. First, you want to go ahead and look for a pulse. This is the spot where you'll be placing the head of the stethoscope over. Now you want to go ahead and insert, place it right above their artery, and then now tightly snug it. Next, you want to make sure that your knob is turned all the way to the right to make sure that air is properly going in. Now we are going to pump up to at least 200 millimeters of mercury. It is important that the patient refrain from caffeine and nicotine prior to testing, which could yield invalid results. Now, after reaching 200 millimeters of mercury, you want to slowly release at a rate of 2 to 3 millimeters per second until you hear the first sound, which is going to indicate systolic blood pressure, which measures the pressure in your blood vessels when your heart beats. And now when the final sound that you hear will indicate diastolic pressure, which is the pressure in your blood vessels when your heart rests between beats. Therefore,